Star 927. All day, every way.
I fear the Burger King is losing it.
Is he adding more sandwiches to the two for $8 again?
Yes, look.
And the crispy chicken. Ooh, and the Yumbo ham and cheese. The Whopper. The big fish.
The best deal on island just got even bigger. Choose from the iconic Whopper, crispy chicken sandwich, original chicken sandwich, the big fish, the Yumbo ham and cheese, and make any of them spicy. And two for just $8. Only available at Burger King.
Want more sports? Get the best seats in the house with Logic. Enjoy exhilarating, nail-biting sports content with C Sports, a new addition to Logic's Premier Sports Pack for $25 a month. Sign up for Logic Premier Sports Pack and catch all the Premier League, NFL, and UEFA Nations League games. Watch all the action on Logic TV channels 531, 2, and 3, and wireless TV 207, 8, and 9. Call 745-5555 or visit logic.ky. Logic, your life connected.
No matter where you are or where you're going, you deserve to be in control of your freedom. Introducing the new Cayman National online banking and mobile app experience. Enjoy quick and safe access with facial recognition and fingerprint login. Transfer funds and pay bills with ease. Sign up for online banking today and download our new mobile app available in the App Store and Google Play Store.
CUC reminds you always to be aware of power lines. Look before planting trees. Always ensure that the tree you are planting will not grow in overhead power lines. Check the CUC's customer service team at 949-5200 or via email at service@cuc.ky to ensure your plan of action is safe. Safety first at CUC.
What's up, y'all? I'm Beyonce.
Yeah, you know what it is. This is Drizzy Drake. Come on.
What's poppin'? It's your girl Cardi B.
Star 927.
Yes. Premium content, Star 92.7. Welcome. It is a Monday, and we get into the meat on a Monday evening. And let me tell you something. I know you're avoiding it. It is coming for you. The inevitable. What could it be? Wrinkles, arthritis, the slowing of your pace as you walk. Old age is coming for you. And inside the studio, we have a man that may help you to avoid it as long as possible. Also, we have the man that's going to connect you to the man. So, from Health City, Dr. Sunku Gupta, and also the marketing manager from Health City, Dr. Ben Meade. Hey.
So I think my degree, doctor's degree comes from 18 years of Grey's Anatomy, but that's about as much medical school. Matt, great to be with you.
Yeah.
And you mentioned that it's coming for you. It's coming for all of us. To me, we'd be fortunate if it comes for us, because it's a blessing to get the gray hairs and the wrinkles, right? As much as we try to fight it. So
aging gracefully, it's an art. It takes, especially for women, it takes someone who's grounded and who knows themselves and who's comfortable in their own shoes to age gracefully. So,
but for us guys,
let me tell you, first of all, you guys are looking young and handsome. And I don't know, doctor, why are we so obsessed with youth? What is our DNA, or is it just marketing? Why are we constantly trying to achieve younger looks?
Yeah, youth is associated with beauty, so we love beauty and we want to be beautiful all our lives. Youth is associated with energy, and we want plenty of energy. So we want to be running all our lives. We want to be running up to 100 years. We want to be jumping, dancing, doing all that stuff that we do when you're young.
Right, and we're willing to pretend until, yeah,
catches up with you.
No, it's a big business. The idea of makeup, for women, Botox, whatever it takes to give the illusion, even if you can't climb the stairs, you still want to get the eye lift and the tuck here and there. Have you, For men, not so much though. We seem to get away with it. If we go salt and pepper, that's all right.
I can't wait. I have one or two coming in, and I'm waiting for them because I would look distinguished, right?
Well,
Silver hair.
Ben, maybe you can do him justice. Just tell us who we're talking to, his speciality, and a little bit about the doctor in the studio.
Okay, so proud to have with us, first time in the studio with us, Dr. Sunku Guptha. He's a consultant in general medicine, specializing in medicine for older persons. He comes to us with a wealth of experience. He has experience in the UK, where he was a key figure in a fairly large hospital that dealt with older persons and providing them with genuine care. And he's here to tell us that a lot of the things that we think about older persons might also apply to not so older persons in their own mind. So Dr. Sunku Gupta is here. I can go on about his experience. We can share that with you on our Facebook page, and it's on our website. Just click the doctor's bios and you'll see it. I don't need to spend half an hour.
No, it will probably relate to everybody that they themselves need to diagnose early if there was a problem, get checked out to ensure that there's not a problem. Or maybe during this show they might relate more to mommy and say, you know what, mommy is getting up there. The grandparents, there's always somebody close who is up in age. Doctor, you've been in Cayman for 15 months. What do you think about our quote-unquote elderly population as a whole?
So I've been here for 3 months.
Oh, forget that. Yeah, let's go back again. My ear, I need to go to Ben. I need to book a ear, nose, and throat doctor to clean out.
We have one of those.
Oh, okay. Yeah, I did not hear him correctly. So 3 months.
Yes.
What's your first impression about our elderly population?
So I haven't met many older adults. I'm at the moment seeing many younger patients, but the few older patients that I've seen, they're very similar to older patients anywhere in the world. Very kind, very caring, want to know what's going on, want to be engaged in their care, concerned about their health, concerned about their independence, want to be independent as long as they can.
There's this strange phenomenon that when I talk to older people in Cayman, their health is like a social topic that they'll use for conversation. Oh, Miss Mary, how are you doing today? Oh, my knee, child, I am here in pain. And they will use their ailments to just to pass conversation, and it's interesting. I have to say though, it is an interesting topic that if you wanted to, somebody who is sick, you can deep dive into, even if you have a arthritis, there's so many fields and studies and reports and papers. You could do that until the day you die. Is it just that it's fascinating to learn about, or is it that people love talking about themselves? Do you find that the elderly are, that's their main focus?
So when they value their health, and obviously health gives them independence, so they often focus on their health problems. And 1 in 6 adults will have more than one problem. So often it may start with a knee problem, and then you kind of catch up on problems with the heart, or problems with waterworks, problems with bowels. So you can kind of go on to a number of systems. So they do have lots of health problems, unfortunately. But the things that we can do to try and help them, try and give them a reasonable quality of life so they can carry on living independently.
And I'm sure that Health City is ready to open its doors to anybody who wants to extend their life.
Of course, Health City is here about quality of life, quality of service, ensuring people get the care they need. But Matt, as we get back to this topic about aging, growing up, I used to hear the old people, or the older people, right, complain when they were getting up. They hold their hip, and it's like they say a short prayer to get up out of the chair, and you mock them. And now that I'm past years, I find myself in the middle of the night saying a prayer just to get to the bathroom, because you realize the body is not as well oiled as it used to be. So that's why I say it's a blessing, right? But the fortunate thing is now, as we age, we have so much more access to actual science and remedies than generations before us did. Why get old and have a backache for all your life, and then you're 70 and you can't walk?
Yeah.
When there's a doctor who could look at you, help realign you, and you're good to go.
Yeah.
Why have a knee walk with a limp when you don't need to, when these things can get diagnosed and looked at early?
Well, here in the Caribbean, we avoid the doctor. That's especially as men, we avoid the doctor. It's manly to suck it up. If a hammer drop on your toe, just suck it up. If your toe break, it's going to heal eventually. Just hang on.
You see where we have to change that perception slightly. There's some things that, yes, you have to suck it up. Suck it up means don't everybody see you crying.
Go in silence to help.
But first thing tomorrow, call your doctor. If it's a prolonged problem, get it checked out. If you hit your head and you see stars ringing, you don't just clear your head. You make mental notes of these things. You call a doctor. These are the symptoms. You realize, oh, I got out of bed badly today. Okay, well, maybe I slept poorly. Okay, it's happening all week. I should go get it checked out. Same thing if you're recognizing internal problems. You used to go to the bathroom and hit the porcelain like a champion.
Yeah.
And that stream is getting softer. There's a reason for that. You go and get it checked out.
Yeah, men and public bathrooms. There seems to be there's a little bit of tension, when you're beside who can hit it harder, a little bit of power. What just back to what Ben was saying, that waking up in the night. Just is there a time at certain ages you're supposed to wake up once in the night? How much is too often? How much is too much urination when you should be sleeping?
Yeah, I mean, there isn't, you should not be really waking up in the night, especially after you've been to sleeping. So once you got to bed and sleeping, you should not be really waking up in the night to go to the toilet. But often we say, 1 to 2 visits is acceptable. But if you are visiting the toilet every half an hour, every hour, and your sleep is disrupted, then you definitely have a problem. There are other things also you have to look out for. So you visit to the toilet, you find that you have actually passed only very little amount of urine, and then you come back and then you have to go back again, do the same thing again and again, and that's not a normal process. So you go to the toilet and you empty your bladder, and you come back and you sleep until the morning. So you don't kind of keep on waking up and go frequently.
And it all relates to how much you're drinking probably before you go to bed. They said you must have a glass of water before you go to bed.
Yeah, I mean, usually that's the reason we say we allow 1 or 2 people, 1 or 2 visits to the toilet. But in addition to the frequency, you're also looking at the stream, the amount of strain that you're putting to open the bladder, and how much you're emptying every time you go into the toilet. So all those are important. I mean, a lot of things we tend to say are due to aging, but not all older people get up frequently in the night. Not all older people have difficulty passing urine, so it's not a sign of old age. It's just you may have a little bit of slowing of the stream as you get older, but increased frequency and having difficulty passing urine is definitely something abnormal, and best to get it checked out.
Yeah, that's the rule of thumb.
Absolutely.
Better be safe than sorry.
Yeah.
So my grandfather on my mother's side lived to be 100 years old. And what was interesting is that he used to proclaim this. I don't know if it was inspired by some childhood dream. I don't know if he had a vision that he would die at 100, but maybe every once in a while he would say in public, I'm going to live to be 100. And he died at 100. Is this considered? Are we getting closer to 100 as a normal age? The Queen unfortunately passed at 96. What is the average lifespan in 2022? How long are we supposed to go for?
So the lifespan has increased over the years. So at the moment, I think we can expect to live until the age of 80, sometimes late 80s. So that's increased.
Ben, that sound young now? That sounded young, man.
There is also this thing called healthy aging. And that's aging without any difficulties, and that's we're kind of averaging around 69 to 70. So we kind of spend about 10 to 12 years having difficulty with old age, suffering with problems. And that's where we come in. So
yeah,
we
no,
can- we can make
I
it
don't
right.
wish that for myself or for any
Absolutely.
loved one. There is this idea of just my grandmother would sit on the couch and say, "Lord, take me now. I'm ready. I want to go." And she was healthy.
Absolutely.
She would not pass, and she wants to go, and there's nothing stopping her, because you lose all your friends, you lose the ability to socialize, to leave the house, to drive a car.
You need
But-
to relearn how to use a phone,
But
depending on what age.
man, if TikTok was around when she was there, she'd be in Christian TikTok all day. But is that something, Ben? Do you fear death? Is this something that keeps you up at night?
Oh, you're really getting deep on this.
Well,
one.
yeah, man.
What I want is to have quality life, to be a grandparent. That's my. If I were to be honest with you, that's my goal right now.
And then define quality life.
I'm able to hop on a plane, go see them. I'm able to have them on my knee. I'm able to take a walk with them. Able to watch them do things that they enjoy.
Throw a ball.
I might not be able to kick a ball with them. at
Hell,
that
see,
age,
here I come.
But to be able to throw a ball, right? And I'm fairly young, but I'm at the phase of life where I'm looking forward to being at the age where I could be a grandparent. And I've told my children I'm in no hurry. So I'll do my part to age as gracefully as I can. And they take their time, finish their education, and then we could have the grandchildren.
I wonder if there's some breakthrough. I mean, it seems that the lifespan used to be, I don't know, if you're living in the days of medieval times, you might have lived to be the ripe old age of 30. And every couple of years, we keep on pushing it and pushing it. So was there some technological breakthrough? Did our agriculture make a big difference? Does everybody have more access to food and sunshine and clean water? What is pushing this? Does Health City have a new machine? What's technology saying?
All that you mentioned, the clean water, everything is important, but we've also advanced in medicine. So we are able to cure a number of infectious diseases, diseases that used to kill us before. All these bugs, we can cure them, we can kill them with antibiotics. So that's kind of revolutionized our medical care, and therefore allowing people to live older and live longer. We can also live more healthily because we've got more things that we can do, even with chronic problems, like what Ben said about arthritis, having a back pain. So it's this kind of cascade of symptoms that patients with older people tend to get is when you have difficulty getting out of bed because you have a stiff back, and you then find that that difficulty is limiting you in terms of your mobility. You tend to want to sit in a chair and not want to do much because of the stiff back. So what we want to do is try and prevent that kind of loss of mobility and becoming more and more frail. So we want to attack the back pain. We want to get the back pain better. We want to get them getting out of bed, getting out of chair more easily, so that they can walk about and keep their independence. So we can do all those things now.
Suppose somebody has been suffering with knee pain, for example. They have been somebody said, you know what, you should go and get that checked out, and every year it gets worse and worse. Is this that the cartilage is gone? Is it just explain to me what is causing the sensation of pain? What can be done to either assist it, or if surgery is needed, what does the surgery mean? What are you actually getting into the knee to do?
So the knee obviously is a weight-bearing joint, so it takes our weight, and obviously as we put on more weight, it takes more load, and therefore there is kind of attrition. The cartilage that lines the joint surfaces of the knee, it tends to erode away, and as a result the bones get exposed, and these bones then start rubbing against each other, and that's what causes the pain. So it is a progressive condition, but we can stop its progress. We can definitely, once you get knee pain, you yourself find that you're kind of walking abnormally. So instead of distributing the weight more evenly, you tend to give put weight on other joints, and you end up causing problems with the other joints. So it's important to get it checked over, looked over, see how you walk, see you're distributing your weight properly. We can also reduce the inflammation, reduce the pain with painkillers or pain gels, and that usually kind of takes the pain away, allowing you to walk normally. If it gets progressively worse, then we can operate give you a new knee, and that definitely gets rid of the pain. It enables you to walk happily. But we want to try and avoid you to getting to knee surgery. We want to try and see if we can get that stopped. We can do things that will enable you to control the pain and walk as normally as you can.
You remember when you were a kid and you were playing with sharp objects? Your mom would say, "You can't buy an eye in the store." But now you can buy a knee at Health City. So you've really delved into orthopedic surgeries. Obviously, you started out as the hospital that was everything cardio and hip surgery, knee surgery. Is this something that was intentional, or you just found that Cayman has a lot of orthopedic problems?
You find that in any community, and one of the things Health City wanted to do from the start was to be able to provide services that there would be a need for. As you know, is looking at getting medical tourists coming to the Cayman Islands, but also services that the local population could avail themselves of. And now we've brought in a whole range of specialties so that we can provide holistic care. And that's sort of why we wanted to have Dr. Guptha with us this evening, because after the break, we can talk about some specific ailments that impact us as we get older. One of the things maybe Dr. Gupta, you can explain is how you work closely with physiotherapists and occupational therapists, social workers, to help persons who have mobility issues or other issues that then impact their regular mobility.
Yeah. So even with the orthopedic surgery, as I mentioned, they usually have more than one problem. So often they have high blood pressure, diabetes, or cardiac problems. These are not picked up. So often patients do not realize that there are other conditions that are going on. So we prefer to see the patients as a physician to try and see if we can help control those conditions before they have the operation. And once they have the operation, we then carry on looking after them. And this is the time when we get the physiotherapists and the occupational therapists involved. And so when we are seeing physiotherapists, basically we are trying to see if we can get them out of the bed and get them mobilizing as quickly as they can, because the longer they stay in bed or the longer they stay in chair, they tend to decline. And then that makes it much more slower for them to recuperate and return home quickly. The occupational therapists are the therapists who tend to help you with getting out of the toilet, getting into the toilet, so they can provide you with high chairs, which makes it easier for you to sit on the commode so that without causing any pain. They are also able to provide you equipment at home, so you can walk with support. If your balance is impaired, we can provide you with railings, so you can hold on to the railings and walk about. So these are the things that we can provide and help patients with. So the recovery is now much more quicker because we have all these therapists, and I closely work with them because once they start rehabbing, they can have what we call blocks. So they suddenly find that they are not able to progress as well as they should when they're trying to get up, they might feel a bit dizzy. So the physiotherapist might say, okay, you know what, I can't do this therapy session with you because you are at risk of falling down. So that's when we come in and we try to stop the dizziness, try to cure the dizziness so that they can carry on with the therapy and recover quickly.
Yeah, you really have to treat the body as a whole.
Absolutely.
I mean, it's all, especially your skeletal system and your muscles, it's all a series of levers and pulleys that one affects the other. So to strengthen one, you need to stretch one. And like, yeah, if you fix their knee and just send them back out the door, it's just a matter of time before they come back in.
Absolutely.
Very good coverage at Health City. I went down there because I woke up with a stiff neck for the third time in the past year. And I said, maybe it's something to do with a nerve or a disc. So I said, let me go and see a neurosurgeon. I walked in, got a consultation, got an x-ray done, walked out with good news, a pack of medication. I have coverage through Cayman First. I paid $29. Not bad.
Excellent.
I feel like I'm preaching to the choir because you know the billing, but how is the elderly going to pay for their health care? And is it how can we as a country ensure that we take care of the vulnerable?
Okay, so that's a whole other discussion
political
for another day.
Political time.
No, yeah. So that's a whole other discussion for another day. But with patients who are coming to Health City, especially those who are being referred, they would have been pre-approved by the time they came to Health City. So if you're dealing with your primary doctor who then referred you, and if you have great insurance coverage, that's amazing. So that's why we pay insurance, right?
Yeah, but it seems that a lot of the complications are the same. Like you said, when we're looking at old people, they all have kind of a similar posture. They're a little more hunched over, like nearly as if they're trying to prevent from falling forward. Like they're just getting a little bit closer to the ground so they can get a better center of gravity. But it would be good if the powers that be, helped in any way that they could with the elderly and the children, Ben. That's what we have to look out for. And I assume
elderly of the children.
No, the elderly and
the
children. Most vulnerable. You see, you're a child twice. Once as a child, and once
a man, twice a child.
But
are they politically correct today? Once a person, twice a child.
Poetic. Are their bones more fragile in the case that they, falling as an elderly person is a big deal? Mama fell in the tub. Oh, that's so. What's happening to their skeletal system?
So we usually tend to start losing bones, particularly women more than men, especially after the menopause. So the calcium from the bones starts going out, and as a result, the bones become porous. They become thinner. So we call this condition osteoporosis. And there are really wonderful treatments to prevent the osteoporosis from getting worse. We have wonderful screening tools. So what they say is prevention is better than cure. So it's best to have a checkup to try and see if you are at risk of osteoporosis. So we have a risk scale where we can put the patient's details in, and then we can assess their risk. And if there is a high risk, then we can do a scan to find out how thin their bones are. And we have really effective treatments, wonderful treatments, and that can keep the patients upright. So spine, as you say, is one.
At what age would you recommend that somebody seriously consider checking you said the thickness?
Yeah.
Is that it?
Yeah.
When should, you said women suffer more?
Yeah, especially after menopause. So the guidelines are women after the age of 45 years. It's when they tend to have menopause. So if they have had menopause, then that's the time you want to try and get screening done to see if there is, if you're at risk of osteoporosis.
And this is just a series of medication. Is this, do you have to put the physio into it? Oh, you have to go and exercise at least 1 time a week. I want to see you doing pull-ups in 6 months.
It's a combination of both. So medicines to try and help the bones, but also physiotherapy to try and build up the muscles. So we often do not build up our muscles of spine. So we don't have specific exercises that we do on a daily basis
to strengthen
the back.
Drink milk. Remember our marketing friend. There was a big campaign about drinking milk, which is going to give you calcium, and calcium is good for your bones. And I cut out milk probably 6 months ago.
Mm-hmm.
Yeah. And I mean, should I be looking for an additional source of calcium?
Absolutely. So you need calcium every day. So we tend to suggest if you're not having any milk, or if you have any intolerance to milky dairy products, then it's probably best to take calcium supplements as well as vitamin D supplements to try and help keep the bones healthy.
And I assume that when you are prescribing medications, it can be pretty complicated because she might be or he might be on high blood pressure medication or medication for another issue. And then you're adding on to it and you have the mixing and the matching.
Yeah.
Is this common that you have to try to?
It's very common because, as I said, 1 in 6 adults will have more than one condition, so they often end up having tons of medicines to take, and that's one of the reasons why older patients are put off. They do not want to be keep taking more and more medicines. But with osteoporosis, we now have once a yearly injection or 6 monthly injections. So these are things that we can discuss with the patient, and then we can work with them. So it's often a discussion when you come to an older adult. You can't actually force them to do things, so you have to talk to them, reason out with them, and come up with a plan that's acceptable to them. So compliance, taking the medication is really important. Me prescribing is fine, but them wanting to take them and keeping to that regime is often difficult.
So Ben, if somebody is out there listening and they're thinking, I have a reason to believe that I should get my mom, my dad, sister, somebody, a grandparent in to see a spouse in to see Dr. Gupta, how do they go about that?
Okay, so there are two ways. So if you at home and able to write this down, it would be info@healthcity.ky, or you can call 640-4040. That's 640-4040, and our appointments team will do a great job of ensuring you get the appointment you need. Again, the email address is quite simple. It's info@healthcity.ky.
And
the team will take care of you.
No,
you
I
can let
can-
them
I
know
can say
that,
that,
you were listening to Matt Brown talk about his desire to age gracefully, and you were inspired to call, and you're looking at an appointment with Dr. Gupta, and they'll take care of you.
Beautiful. We're going to take a short break. On the other side of the commercial break, we're going to get into some specific diseases, something that is probably considered common, and can it be cured? Parkinson's, Alzheimer's, all of that and more coming up right after the break. Stay tuned.
Follow me. Watch out. Hit us on social media. Follow me at Star 927 Cayman.
Get the drive with Lucozade Energy. Buy Lucozade and enter for a chance to win the grand prize of a Toyota Hilux. Plus, win up to 500,000 instant prizes, including Fitbit watches, GoPros, earbuds, Amazon gift cards, and free Lucozade. To enter, buy one of the Lucozade Energy promo bottles and look under the cap for your code. Enter it online or send it via WhatsApp, see press, and social media for details. Buy, win, and get the drive with Lucozade Energy today. Lucozade, taste the energy.
Move with us, Cayman. Fidelity Bank is now Proven Bank. We will continue to serve you with the banking services that you've come to rely on, while moving you to another level of banking experience that you deserve. As members of the Proven Group, Proven Bank keeps your life and money moving. Learn about the Proven difference yourself at provenbank.com. Move with us. We are Proven.
For over 25 years, Island Heritage has weathered more than 25 hurricanes throughout the Caribbean. We've been there for our customers, settling thousands of storm-related claims, delivering best-in-class customer service, and paying out over $1 billion to support our customers. We are Hurricane Strong. We are Island Heritage. Visit islandheritageinsurance.com today.
Attention, Cabinet has extended the pensions holiday until the 30th of September. The Department of Labor and Pensions reminds private sector employers and employees that the option to pay additional voluntary contributions remains. However, the other party is not required to contribute as well.
Star 927.
They can't stop me now. Shut it down. Connect to the culture.
And we are back on a Monday with more premium content, something that could extend your life or extend the life of a loved one you know. And just think about your beloved granny sitting on the couch. Wouldn't it be nice to do something special? A day out at Health City. That's a social call. So we want to get down deeper into some of the specific conditions affecting our elderly population. The most common, or the name that comes up, is Alzheimer's disease. And correct me when I go wrong. I'm just trying to throw what I know out there. But this is a disease that would affect the brain, specifically your memory.
Absolutely.
And do you have any numbers on how many people here are affected?
So I don't have specific numbers for Cayman, but I know Alzheimer's dementia is the commonest type of dementia. At least in the US, they have about 5 million adults with Alzheimer's dementia, which is likely to triple in the next few decades. So it's a very common condition, increasingly being recognized, and that's largely because we're living longer. And age is one of the biggest risk factors for Alzheimer's dementia.
And it not only affects the person, but it affects the family.
Absolutely.
If you dealing with children is rough, and when you have to say the same thing again and again, and it must be very frustrating if you have to tell your father that, listen, mommy is no longer with us, and she says, well, where is my wife?
And Matt, it is particularly painful on the family when you think of these have been the pillars that have brought this family forward, and you see them aging, and sometimes not so gracefully, and you have to accept that there are some things that are going wrong. but there's help. So it's like getting frustrated with grandpa because, yeah, as you say, you told him grandma is not there anymore. And then he comes back tomorrow and asks you, where did grandma go? I only sent her to the shop this morning. She should be back by now. And it gets hard on you yourself.
Sometimes
so put yourself in the position of the person who it's impacting directly. We always like to think of the impact on ourselves. When we can see, okay, this person is having an issue, but somebody in a position where, no, as far as they know, everything is okay.
Yeah.
And we get agitated and worked up because it's frustrating, yes, that you're repeating stuff. And you're also getting upset because, man, Daddy used to be a center back in football, man. He was the best. He would knock down anybody. He could climb a coconut tree faster than anybody I've ever seen. And this is the gentleman you're now seeing. So, yeah, so we have to accept that it is hard on the family unit, but there are ways we can help.
And it's also frustrating to the patient himself because he is aware that that his memory is failing him, and constantly being told the same thing will agitate him. So he doesn't he feels unhappy that he's being told the same thing when he believes that what he's talking is right, and that can be quite frustrating, and that can lead to kind of agitation. So they can become a little angry and upset, and being upset and angry with family members, close family members.
That's it.
It's going to be more stressful to the family.
There was a case where somebody I know, their father had Alzheimer's, and they used to go to the HSA, but the father didn't even recognize the kids. So it's nearly like, who are you? What are you doing in my room? I think at one time he accused them of stealing. He said, you're coming to rob me, and it's human to be like, yeah, I can't deal with this. I can't. Every time I come to see you, it's just a problem. And then you write it off and you say, oh, you know what? They don't remember anyway, so I don't need to come back.
No.
There's ways of dealing with all of it mentally. Absolutely. But it's a family problem. So what is I don't think it's a curable disease.
Absolutely right.
So what are we going to do?
So we have very effective treatments now to help patients with Alzheimer's disease. These treatments not only help improve memory, but they also help with these behavioral symptoms, the agitation and the aggression that patients experience from time to time. So in addition, these patients also tend to have what we call hallucinations, where they imagine seeing things, and that can lead to paranoia. So you might say, okay, somebody came and visited me, but your family says, no, there is nobody been there. But to them, it's very real, and they don't then trust their family members, and they start then getting agitated, angry, and upset with them. So the treatments that we have are called cholinesterase inhibitors. It's kind of medical term. But basically, one of the chemicals in our brain called acetylcholine helps in connecting the various parts of the brain, and that goes down in dementia. What we can do is we can replace that chemical with medicines, and that kind of helps improve memory, but particularly helps control these behavioral symptoms. And they are available in the form of tablets. And the commonest one that everybody has heard of is Aricept or donepezil. We also have patches. The patches are particularly helpful. Say, for example, you have a dad or a mom who's got dementia and they're getting agitated, and you want to give them medicine, but they refuse to take it because they feel that they're being poisoned, or they feel that that they're being forced to take medicines against their will. And this again causes more problems because not having the medication makes the agitation more worse. So what's the best way to deal with? Sometimes they may have vomiting or diarrhea and they can't take medicines. Sometimes they have problems swallowing the medication, so they might just spit it out because they experience bad taste in the mouth. So often what happens is when they don't take these medication, they tend to become more and more agitated, and in the end they end up coming to the hospital. And a hospital admission for a patient with dementia is very traumatic because they're completely in an alien environment. So what we want to do is try and prevent patients from coming in, try to keep them in the community, in their own surroundings, as long as we can. The patches are particularly helpful. So in Health City, we now have a stock of patches called rivastigmine patches. These are patches that we use for dementia, and it's a patch that goes on the skin. It lasts for 24 hours, and you can take them out and change them the next day. You can put them on the back, you can put them on the front, anywhere where there is no hair, and they stick and they work beautifully. So in a condition where in a crisis where patients are not able to take medication, the patches are really helpful, and they tend to calm these behavioral symptoms down, and that makes patients to stay in their own surroundings longer.
I hope somebody who is suffering with this as a problem will take the advice and come and book an appointment to go and see you, because it can make a lot of difference. A new medication, a technological breakthrough, even an edge, just a little edge that'll make your life just a little bit better. It's worth going and see the doctor. But I'm wondering what's happening to me, because sometimes I forget. Sometimes I have words that are on tip of my tongue. Sometimes it's a name that I can't recall. What is happening to my brain?
Absolutely. So we all can be forgetful, and that's normal for us. It is the persistence of the symptoms. So if you're forgetting every day, you're forgetting, common things. You're forgetting the names of people that you know of, that you're familiar with. You're forgetting numbers that you're familiar with, like phone numbers. You're forgetting events like birthdays and things like that. Then that is
forget my wife's birthday. That's it.
You'll do that once.
Yeah.
I just blame it on the vaccine. But baby, I don't know. Since I got this vaccine, I just keep on forgetting your birthday. You said Alzheimer's. You said dementia. Yes. I mean, what's the? Is it the same thing? Is it people using words and throwing it out there?
So dementia is a common disorder. We have several types of dementia, and Alzheimer's is one of the types of dementia. Alzheimer's dementia is the commonest type of dementia. Occurs in about 70 to 80% of patients who have dementia. There are other kinds of dementia. They're called vascular dementia, Lewy body dementia. They're much rarer, but they need a specific kind of expertise and examination to come to a diagnosis. The Lewy body dementia is very peculiar in that the memory is intact, but from time to time they get very confused, and they are dominated by visual hallucinations. So these patients are imagining people, strangers in their house, and they're reacting to them. Sometimes they end up making cups of tea for them because they're so real to them.
Wow.
You find these patients who are absolutely fine in the morning, and by evening they're doing all these kinds of things, making cups of tea or shooing away people when they're not there. And when you go and tell them there is nobody there, they find it very difficult to accept it because it's so real to them. So they have this kind of fluctuating memory issues, and they also have a little bit of Parkinson's. They kind of shuffle when they walk. They can be very aggressive when they have these confusion episodes because they find it very difficult. Sometimes these hallucinations or people that they see are threatening to them, so they tend to try and fight them off, and they cannot tell who is real and who is not real. So you might suddenly go and calm them down, and if you're a family member, they might attack you because they don't know whether you're real or whether you're imaginary. So it is a very difficult disorder. It's a very complex disorder, but it's something that once we make a diagnosis, we can manage very effectively.
It is hard because you want to give the medication, and like you said, if imagine somebody wants to put something in your mouth, and you don't know who this person is.
Absolutely.
You think that they're trying to hurt you or harm you. You're going to do all that you can to fight. Then maybe if you're an elderly person, they can overpower you, and then you could call that maybe like elderly abuse. And you could see an image of some big strong man shoving pills down his father's throat, and the police get involved. This thing can get really, really out of hand. But are you familiar with elderly abuse? Is that something that has ever walked into your office?
Oh yeah, I mean, often because these people are vulnerable, they can be easily influenced, because it is frustrating to look after a older person who has got dementia, who is aggressive, because it is 24/7. It is physically and emotionally tiring. So you can from time to time be upset. So I often tend to see verbal aggression from family members, but that's entirely understandable. But you have carers sometimes who can be physically aggressive to try and keep them. So it's something that we look out for. So unexplained bruises, patients becoming withdrawn, patients being anxious. Those are the kind of clues that we look out to see if there's anything like that going on. Unfortunately, it does happen. And when it happens, it is really devastating for the patient because they don't know what's happened. They become childlike, they become almost withdrawn. And it's very sad to see them in that state.
Good care is hard to find.
Yes.
Yeah,
it's very sad. I personally witnessed a case where I saw a bedridden senior citizen being attacked.
Mm-mm.
I actually had to step in. Clearly, I was in a situation to be in the house, not my family, right? But when you see somebody who's given their life for you, and your response is slap granny because granny messed the bed again. If granny can't can't control messing the bed, is slapping the right thing to do? So it's for me, it's the most important thing as I look at my parents' age, ensuring they have the right people around them, the access to the right care. I think that's what we all should be doing, and putting them in a position to age as gracefully as possible. So where you need care, if you're having Alzheimer's, you're having Alzheimer's related issues, dementia, that we get those looked at. Why let them suffer when there's help? That's
and try to be as proactive as you can. If I just need to. I haven't been doing this program for not even over a year, right? I've never walked into the hospital in my life. I avoided the hospital. I don't want to go there. I've never checked into a hospital. I want nothing to do with a hospital. I started this program probably in January. I go to Health City every month. It's interesting. You learn about your own health. You learn about just sitting here talking to doctors. You realize, oh, it's about preventative care. Oh, I can just do. I did a general checkup. I got all my stats. I went through all the machines, the X-rays. But it takes some catalyst. It took this show to make me realize, hey, bro, go get yourself checked out. But there are people listening that are saying, I don't need to do that. That's a waste of money.
Everybody has the come to Jesus moment. Some of us way too late, right?
And I want to tell everybody, just do it before. Just
do it before.
Yeah.
Which is why each week we are here and we speak about different topics, because not each week we're talking about something. It may not impact you directly, but you might realize there's a colleague who's talking about either them or a family member having this issue. Here, we all know somebody who's aging. So this impacts us all. But we have an ethos at Health City now, and it's one we're trying to get into the community. We do not want to see you when you're sick. We will treat you if you're sick. We rather see you when you're well. You spend $30,000, $40,000, $50,000 on a brand new, shiny car, Matt Brown.
I'm looking. Is it a Tesla, Ben? Come on, make it a Tesla.
You tell me whatever it is.
Make it
but you buy your Tesla, you say.
Yeah, man.
Are you not going to service it? Are you going to wait? You've made that investment.
Yeah.
Are you going to wait for a warning light to come on? Or are you going to follow the recommended schedule of getting it checked?
Yeah.
Or just not waiting until, it's on the side of the road, 11:30 a Friday night. I need help. Then it's a major issue. But if you have these things, your body, you have no greater investment than your body. We're only going to get one, as far as I'm aware, which is why take care of it. And that allows you to do the things you enjoy. Me as a father, taking care of my family is the most important thing. So I need to be healthy in order to do that. I already told you about my plan to be a grandfather that I'm in no rush to, but it's a goal.
It's coming, bro.
It's coming. And I won't give away that window. But I want to do those things. And you want to be able to see the joy of your grandchildren coming to see you, not seeing the look on their face. Grandpa in bed, do I have to come and see him every Sunday and spend an hour?
Yeah.
We want to take care of ourselves. We will get sick at some point, but we want to take care of ourselves so that we can take care of the rest who depend upon us and enjoy life.
So on that point, we have a number of conditions that present with memory loss, like thyroid disorders, where you can appear to have dementia, but it's underactive thyroid, and all we have to do is correct the thyroid deficiency, and you find that your memory is back. So we have preventable causes for memory loss, and the best way to find out whether you have one of those conditions is to get these checks. The other thing that we have now is that we know of certain risk factors that can lead to dementia as you get older. So we can act on those risk factors. Blood pressure is one, diabetes is one. You can have some genetic conditions, kind of genetic defects that can put you at a higher risk of dementia. So we're kind of more aggressive in those patients, bringing the blood pressure down so that we can prevent dementia. So getting these checks will be definitely helpful in the long term.
It's a thyroid. Just to touch on the thyroid issue, is our thyroids linked to depression?
It is. I mean, underactive thyroid can lead to depression, dementia, memory loss, so lots of things.
And just to tie it into what Ben is saying, when you want to go and see somebody, you want to sit down and have this conversation, you want to talk about the memories and the good times. Man, you remember when we, and you could just fill in the blank. Go went fishing. Remember the time when we went on this vacation. Remember the time where you picked me up and you spun me around. All of it relates to a healthy mind. And you're saying that there is technology now that can greatly improve the quality of life. So whatever it takes, go down to Health City. It's simple, I've done it many times. That little email address, info@healthcity.ky. You don't have to go in and about some story. Just say, hey, my name is so and so. I want to see. Just leave it vague. A doctor. Just if you don't know what their specialty is, just leave it as vague as possible, and they will call you back. They're going to have maybe a 3-minute chat with you. They're going to get you in front of the right doctor very quickly as well. And let's move on to the other big name in the disease of the elderly, Parkinson's disease.
So Parkinson's disease is a physically debilitating condition. So we have all seen patients with Parkinson's disease. They have this tremor that kind of results in shaking of the hands, which can be very intense. So they are unable to kind of hold a cup or even feed themselves. It can also tends to affect the mobility. So we often see patients with Parkinson's disease shuffling around and trying to walk as fast as they can, but they find it difficult to do so. They're often kind of flexed or bent over. So you get this kind of typical Parkinson's patient. What happens in Parkinson's is we do have very effective treatments. I'll help control the tremor, improve your mobility, and give you a very good quality of life. But as time progresses, these medicines, particularly the tablets, they become less and less effective. When I say less effective, they don't last as long as they should. So you're kind of finding that you take the tablet, it takes about half an hour to kick in, and then it lasts for about 2 hours instead of the 4 to 6 hours that you want it to be.
Yeah.
And that makes it really difficult because they can't plan. So
it's more expensive, isn't it?
Yeah.
You have to keep on buying more meds, and then that is costing me more and more every month.
Yeah.
It's sad that the world still revolves around money, but what can Health City do that the HSA cannot?
I wouldn't like to say.
Oh, yeah, the wrong wording.
I would like to say, what can we at Health City
do? Let's leave it there. Let's just stop there. What can Health City do?
Okay, so when we have these what we call fluctuations, where the tablet have run out, so you're kind of in the middle of a shopping center, and you find that your feet are stuck, you can't walk. You're frozen to the spot. So that's kind of very debilitating symptom. So patients get very upset when that happens because they now are relying on somebody to help them. Say, for example, if you're in a queue and you're stuck, there are lots of people behind you who are going to stop.
I just want to make sure that the listener understands what I'm seeing.
Yes.
You're saying that if you suffer from Parkinson's, you could be walking briskly down, and something in your brain causes your legs to freeze, and it doesn't matter how much you want to walk,
you can't force.
You cannot. And then I don't understand how somebody else might be able to help you. So you're saying that the muscles are engaged so you don't fall, but for some reason you can't pick up the leg
absolutely
and move. That's very weird.
Yeah.
That's very strange.
And often people think they may have a stroke or something, so you end up calling the ambulance and they come into the hospital because they're not able to walk. Sometimes, the kind people tend to bring a wheelchair and sit them down and help them to recover from that phase. So usually it kind of lasts for a few minutes and then you can get the energy back. But what it does do is make you lose your confidence because you're now not sure whether you're going to get stuck anyway when you go out. So you don't want to go out.
Yeah. Social anxiety is
absolutely.
Even with no problems, people are suffer from social anxiety.
So imagine having
you put
major
that
issues.
Absolutely.
Oh my gosh.
So,
but it seems like a disease that really affects your muscles, spasms, inability to control yourself. I have muscle spasms every once in a while. my finger will jitter. What is happening? Why is my finger shaking
So I mean that
uncontrollably?
That can be just a little bit of anxiety, or
No, man.
He's
No.
on the caffeine, just a little bit,
No
just a
caffeine.
little bit less coffee.
The shaking of a hand.
Yeah, so the entire shaking of the back is
What-
often because of the problem in the brain. So we again are lacking a chemical in the brain called dopamine, which is the reason why we have the Parkinson's symptoms. So the connections are not being made. So the brain is trying to help you, but it's not able to sufficiently fire. So it's kind of firing small impulses, and that's the reason why you tend to have the shaking or short steps, very small steps, or you completely get frozen because the brain is not firing off, not firing strongly enough. So the best way that you can describe a patient with Parkinson's is one of the things that my patients told me is that it's like, imagine being tied in your own body. It's like that feeling, and it's there all the time. So it's kind of not very tight, just a little. You have a little room to maneuver. So, but you're kind of tied from head to toe, and you're trying to walk. Imagine that kind of situation. But what happens is, with medicine, we can untie you. We can literally get you back to normal. Get you to walk normally, so get to control the shaking and do things like that. But as time progresses, as I said, these tablets tend to become less effective because they're not lasting long enough, and those fluctuations are the ones that kind of really annoy Parkinson's patients, because they tend to happen anytime, and that makes a mess with their lives. So at the moment, we in Health City have what we call pens, Apo pens. These are Parkinson's pens. So it's very easy to administer. It's like a small injection, like insulin injection. So you can just
EpiPen almost.
Yeah. So you just administer it yourself, and it's kind of quick release. So say, for example, you're stuck somewhere and you're not able to walk. If you can inject yourself, that's fine. If you can't, somebody can inject it for you. And within a few minutes, you find that release coming on, and that lasts for about 2 hours.
Wow.
So having that pen in your pocket is sometimes enough to stop you from having the fluctuation, because you know that there is something that's going to help you.
It's a confidence booster.
Absolutely.
It definitely. Yeah, I can see that. And this is something that you go to see the doctor says you suffer from Parkinson's. You will write the prescription. They pick it up right at your pharmacy. Is this something that can be done in a day? Suppose somebody is suffering today and they want relief.
So the first thing is we need an assessment to see what stage of Parkinson's they are on, and 70% of patients with Parkinson's respond to these pens, and we need to find out what dose they respond to. So we tend to do what we call a challenge, when we bring the patient in and give you different doses every half an hour, see how you respond to this challenge, and then we adjust the dosage and give them pens to take home, and then they can start using the pens at home. So it's kind of, once we assess you and say, okay, pens will be really helpful to you, we will need to do a challenge, which usually lasts for about half a day. And then once we've done that, you can then take the pens home and then use them as and when you need them. And you can use them up to 10 times a day if you want to. And it really kind of helps transform lives, especially those patients who respond to it. It's kind of, some patients describe it as magical.
Matt, you look terrified a few minutes ago.
I think,
but no, I'm seeing optimism in your eyes.
No, I think the word is that he just used magical. It's nearly like technology is magic. If you went back to the days of Moses and said, "Look, Moses, a plane," magic. It's technology. So if we can use that word pretty loosely, but it's the end of the program. I'm glad that I got to probe a few questions. If there was something I missed, please tell the public. This is the chance to say either to get into Health City or something that you offer that we didn't cover.
Yeah, I mean, what I say now is, try not to be scared of old age, and try and get your checkups done, and we can do a lot of things now to prevent old age from being a difficulty. We can let you enjoy your old age, have an aging with dignity and without pain. So please come and see the doctors, any doctors, not just me. Try to get checked up.
You want to give us an overview of what you're doing? Cardio, osteo,
we
orthopedic, neurology,
so many
gynecology,
specialties, ENT, spine and neuro. We
cancer treatment,
oncology, right? We do medical and surgical oncology.
Yeah,
and we'll have these guests coming in a few weeks. There are so many areas that if I start listing now,
Well, we
I may miss
covered a
one or two
bunch,
and we take up
but
time.
yeah,
And then we're also adding a few more as well, right? So I just wanted today to be for us to think about us, think about our parents, think about our
Mhm,
grandparents.
mhm.
Stuff that we're talking about, you likely have seen in your life, right? And you're saying, oh, okay, maybe I shouldn't have been this hard on grandpa or grandma. But guess what? There's help. So if you have questions about what we're speaking about, these aging scenarios, we're here to help. And if you have questions about something specifically raised, send an email info@healthcity.ky. info@healthcity.ky. You can call our call center 640-4040, and they will put you in touch with the right person. And if you need to get to Dr. Sunku Guptha, they will do just that.
Well, thank you for coming in, Sir Ben. Thank you for bringing the good doctor. Doctor, thank you for bringing your experience and your knowledge to the Cayman Islands. He's been here for 3 months. When you see him around Foster's, tell him, say, yeah, I heard you on Star. Great job with the interview. So we'll do it again next week, right here.
Thank you for having
All
me.
right. More premium content coming up on Star 92.7. Oh, Ben, I forgot to push this button. This is the button. Right? Yeah, there we go. There we go.
I can see you